The good news for you guys is we have prizes for our quiz, and you're definitely going to win a prize.
Yeah.
Avo, you guys are should be on mute. Yeah. Okay, great. And so my name is Rod Beadle. I am the water team director at CARE. And Clover, you want to introduce yourself?
My name is Clover Demerit. I'm the Water and Ecosystems Technical Specialist at CARE.
And online we have Nivo Ramanam Lihan Tato Jo Rana. We have Meva with Foundation Mérieux. We have Meva Rakotson with HappyTap, Hariosa Rasa Melina, and Avo Ratayor Ijana with CARE. And if that doesn't qualify me for pronouncing the longest names in this entire thing, I don't know what does. So today we are going to be talking about hand washing practices in schools, specifically in Madagascar. And we'll be reviewing the results of a pilot study that CARE conducted along with HappyTap and Mérieux Foundation as part of our USAID-funded Rana Wash project. Rana Wash was a 5-year program, involved a lot of innovative wash improvements, ended a year ago. That's what this program, our pilot study, was part of. And as an add-on, we're currently in the second phase of Rana Maharitra, we call it, which is also a 5-year USAID-funded program. There we go. So for our session today, it's gonna be somewhat interactive, and we're gonna encourage participants to work on strategies for promoting hand washing in schools with soap. And that'll be working with and developing some ideas around nudges, and then also we will present and discuss the findings of the study that we had completed as part of Rana Wash on combined approaches to improve hand washing in primary schools, specifically in Madagascar. This is just an outline of the side session today. We start with the introduction. We're going to have a quiz around hand washing. We do have prizes, and again, the good news is that in that we don't have a full room, it won't be too hard to distribute those prizes. And then I'll give a little background and context around Madagascar and the study. Then we'll have, I think Meva is going to be presenting the results of the study, which is the bulk of the presentation. We'll have a question and answer session after that, and then just summarize our key takeaways in conclusion. So with that, let's start with our quiz, and I'll hand it over to Clover for that.
Thanks. Okay, so most people will probably get this. Question 1, what is our body mainly?
Oh, sorry. Keep track of your scores. So some of these can be more than one answer, so you got to get all of the options to score 1 point for each one. So that way we can track who actually gets everything.
Yeah, we'll ask everyone at the end. So yeah, question 1, what is our body mainly made up of? Bone, fat, muscle, or water? And
this one only has one answer.
yeah, surprise, surprise, it's mainly made up of water, between 55 and 75%. Question 2, what elements influence how much water a person needs to drink? Is it their age and weight, the state of their health, the outside temperature, or the type of activity, or a decision of a politician? And this is a multiple choice question.
And can have more than one answer.
Yes. Okay, and the answer is A, B, and C. Depends on age, weight, outside temperature, the extent of water loss due to sweating, and the state of health. Question 3, is transparent water drinkable? Sometimes, never, always, or every other time. This is just one answer. And the answer is that clear, transparent water is often drinkable, but not always. Cloudy water is unfit for consumption. For question 4, river water is polluted by all of these elements except one. Which one? So there's also multiple answers for this one. Is it human microbes, animal microbes, pesticides and minerals, or malaria? And the answer, or sorry, just one answer. The answer is malaria. Is not caught in the water, but by the bite of an infested mosquito. For question 5, what do we use to wash our hands properly? Is it soap and water, a clean cloth, zebu fat, or just water alone? This is just one answer. And that answer is hand washing is done with soap, or if not available at all, with ash. So washing with soap and water is better than nothing, but it is not enough. For question 6, how long would you recommend washing your hands properly with soap? Would it be 20 seconds, 1 minute, 2 minutes, or 1 hour, 24 minutes, and 32 seconds? A lot of water. And the answer to that is 20 seconds. It only takes 20 seconds to wash your hands properly after wetting them and putting them on soap. For question 7, when to wash your hands? All but one of the moments listed below are essential, but which ones? Is it washing your hands after going to the toilet, before going to the bathroom, before preparing the meal, or before sitting down to eat? And the answer to that one is B. The most important moments to wash your hands are before preparing the meal, before the meal, after going to the toilet, and after changing the baby or when being cared for. For question 8, washing hands with soap can prevent all but one of these diseases. Which one? So washing hands with soap can prevent certain skin diseases, or is it diarrhea, or is it pneumonia, or can it prevent cancer? And the answer to that is washing hands with soap has no effect on the occurrence of cancer. On the other hand, clean hands are in a child under 5 years of age reduces the risk of death from diarrhea by 40% and respiratory infections by 25%. Question 9, what are the effects of intestinal worms? Is it A, having academic difficulties, B, having stomach aches, C, sometimes it's beneficial, or D, it can cause serious medical or surgical complications? And the answer is that intestinal worms are responsible for tens of thousands of deaths worldwide each year. They can also be responsible for malnutrition, anemia, growth and schooling disorders in children. So there are no benefits to intestinal worms. And for the final question, how are intestinal worms caught? Are they caught by dirty hands, by poorly washed food, through the skin, or through mosquito bites? And for our final answer, is that intestinal worms are very common in children and adolescents. They are caught by a lack of hygiene of hands and food. Some worms enter in larval form under the skin without us noticing, though bare feet or during swimming in fresh water as well. Okay, so I think we still almost have enough prizes for everyone, but Does someone want to raise their hand if they got all the questions right?
10.
10, yes. 10 points. Did anyone get 10 points?
Well, and that's great news because we are giving out water bottle filters for when you travel and can't wash your hands. It's a micro filter. Elise, you get a prize even though you're late.
Yes.
Did anyone else get 10 points?
Anybody else want a water filter?
Does anyone else want a water filter?
I mean, I just got this one wrong. I didn't, the skin, I was like,
So it's a
9.
9 points. Anybody else 9 points? Okay, so. And then for everyone else, we have, these are really cool too.
Yeah.
I was hoping we wouldn't have that many people. I was going to take one for myself. We have rehydration salts, or rehydration powder, provided by Liquid IV, which is a donor to CARE on some of our water and wash projects. So we have one, and there's 8 in each. 2, 5, and here. Enough, sure. There you go. I hope so.
You're good. Good prices for sure.
I'll get a late
These, I used to do a lot of disaster response work, and these actually come in quite handy.
These are
They are cool. Great, so next I'm going to talk a little bit about the background and context of the study and the work that we did around hand washing in schools. But I'll let Maba give the full presentation. So just a little background on Madagascar. We all know it's a large island off the southeast coast, east of Mozambique of Africa. And in Mozambique, or I think that's worldwide, 1.7 million children die every year from diarrhea and respiratory infections. Also as a major cause of high school, of actually all school absenteeism. Diseases, waterborne diseases are typically more effectively treated through good hygiene practices, even more effective than clean water. I forget what we call that diagram, but the flow of microbes into the body can most effectively be blocked through good hygiene practices. And different approaches led by WASH sector around instilling behavior change were also an important element of our program in the Rana WASH. A little bit more on Madagascar, and one of the things I love about water and sanitation people is we can put pictures like that up and nobody really says, oh. But Madagascar actually has a population of 30 million people. I was actually surprised by that myself. But a gross domestic product per capita of around $536 per year. So that definitely qualifies as poverty stricken, and I believe that also is extreme poverty. It is the 5th poorest country in the world. And only about 60% of school-age children are actually enrolled in schools. And in rural areas, it's typical for a child to have to walk, we say at least, but I think that's probably around 5 kilometers just to reach school. And 85% of public schools in Madagascar lack access to clean water or safe drinking water. And 38% of public schools have no functional latrine whatsoever. So those are very high numbers for any context. We're gonna, before we present the study, we're gonna have an interactive session ourselves, and we're gonna divide into 2 groups. And one group is gonna work up here with the flip chart, and we also have post-it notes if that'll help. And you're going to work on one subject. I think it's developing nudges. Then I'm gonna set up this in the back with some, or maybe Clover, you can take this back there and set that up. It sets up so it'll stand by itself. And you're going to work on ideas around development of curriculum for hand washing in schools. And then we'll do it, I think that this session is about 20 minutes, and then we'll take about 10 minutes for the two groups to present what they came up with. So, and obviously, nudges and hand washing education, school curricula are an important element of what we'll be presenting today. We just want to get some ideas from you folks on what you think good elements to that would be. So, and we'll count off in just a second. But so group one, which is going to be over here, is going to work on creating and imagining how the school environment should be to encourage hand washing with soap. And what are some good techniques in your minds to encourage and nudge students to practice good hygiene practices, definitely based on your experience. And this is not just limited to Madagascar in context. And then group two is going to be back where Clover is at. I've got some markers for you guys as well. And group two is going to develop ways to integrate hand washing education into school curricula using technology and interactive methods based again on your experience. And this also is not limited to Madagascar. So let's divide into two. I'll just point and you do 1, 2, and ones are up here, twos are here. So
1,
2, 1,
2,
1,
2, 2, 1.
Okay. So ones come up here, work on the first, and 2 back here, and I believe we're taking, what did I say, 15, 20 minutes till 9:15 to do this. Yeah, so about 20 minutes.
Do you want me to set up a timer?
That'd be great.
Okay.
Yeah. And again, here's, did you bring those back already?
Yes.
Funny, I almost forgot though.
There's not been enough coffee yet. So it's like a quiz.
This isn't fair to do this early in the morning. Here's some markers for you as well. So this is group 2, right? Yeah, okay, so this is
All right.
There one.
ideas for integration into curriculum.
You were one, I'm a 2.
So you want to work with group 2? I'll work with
Yep, that sounds great. Hi there. Hi everyone. Thanks for coming out. Oh, sorry to make you think.
Fold chairs around?
Yeah, whatever you guys want to do, and again,
You have no bias. You can be creative and.
Perfect, that's all we have.
Chair?
the example I think of in this context is for men and airport afterwards where they put the little B on the back of the journal so that men aim and don't flash all over the place. So what sort of nudges, but in a school context, what sort of nudges, what sort of things would you use to encourage children to wash their hands?
It's memorable and they look forward to it.
The activity we just did and a bit of competition, I think the kids can do like games and something like you will earn points if you wash your hands. I don't know how to track it.
Some kind of monitoring system for the soap dispensers.
Washing memorable.
Then you just get boys, no.
How you?
But I do feel like
I like that one.
like shapes that are fun. I feel like I've seen that in some of our other country contexts. So thinking about like
Maybe use paint
so,
and use like steps that show.
Yeah, fun colors.
colors,
stuff.
like,
Yeah, like that.
I don't know, something.
Okay.
That makes me a detail that I'm a little bit. So, just like, see, some parts are really detailed things. Yes, thank you.
Yeah.
Great point. So something like that. So
Okay.
Sure.
You said errors and footsteps?
Yeah.
Or you said footsteps?
Madagascar.
They had that a lot during COVID, especially like in school bars, I think they were.
Yeah, and actually, so that the COVID experience, if we have been true, you probably have to.
It could be linked to the game inside, no? Like it could be like those like jumping airplane man or something
Or
like that.
like animal footprints, like, yeah.
You don't think there's a conference about that? It's really cool.
I went through a few years. It's amazing. I always just like a color.
So I don't know if there's like some way to like,
Like you could have
like make like the achievement in public.
science curriculum or something. So it's like talking about bacteria and things like that. So it's cool education.
It's already incorporated in the subjects.
Yeah. Read stories about it and like keep incorporated in every.
What if there was a way like if they didn't wash their hands or use the soap or use it, like, I think it was that show, like they didn't drop goo on you, from the ceiling. Like some way to give a public embarrassment if you didn't wash it.
Shame.
Yeah, shame.
Powerful motivator among
Yeah.
children, yes.
Shame and fear, that's
Yeah, glitter, like a glitter bombs and everything.
Costumes that
Well, and actually, community-led total sanitation programs, a lot of people say that shame is an element of encouraging communities not to practice open defecation. So I'm not so sure I like that element so much, but it is integrated.
culture songs, they like made it to watch songs. It's so waiting for the record. Somehow I wonder, it's sort of building on that, just like some sort of art contest or like something like about kids.
Oh yeah, like how like you say like happy birthday twice, like when you're washing your hands, like
Visually talented. And then also like the theater.
whatever song is like really popular with like kids or whatever.
Feeding into.
Can we also go back to the public embarrassment, because you said like glitter, and so like making, I think like making the shame element or the oh you didn't do this like fun, so that there's like not so much fun if there's like a distance that you're making it so that it's like not like oh you didn't do this pointing the finger, but like some element of like
Yeah,
fun
and the
teaching.
display, and yeah, the humor stuff, and then you trust it.
The problem might be figuring out how they didn't wash their hands.
And also if they like the punishment, they're gonna start washing their hands to be punished.
Yeah.
No? So you can make it that way.
Yeah.
I put it fun.
Right.
Not very well worded. Not that way.
There should probably be some form of education on disease and like why it's actually important. I think a lot of these are like all like fun things that either cost money or are not much, but like having some actual reasoning. I mean, they're still children. I get that they can't comprehend everything, but even a first grader understands.
Having repeated
You don't want to touch waste and food, and understand the barriers is important. That can be like cultural and like educational, I think.
And it could, I think this could be linked to the gamifying it. No, you could do like a, I don't know, like a fictional villain, like color,
Elements like that, I think the
it's
connection,
nice,
right?
it's better, and then
Hand
you
washing day,
can do
multiple
games around
day,
that,
next
that are
day,
like educational, no,
after
but also
days
that.
that come back to like highlight it as intersectionality. No, I'm so pro.
Because I think they're talking about that.
I'm thinking about both
Education and art, no? So this,
I feel like I'm a little
More
bit
on the
cheating, but I
non-
am also decently familiar with drawing.
I
But.
saw once, I'm from Mexico. I saw once a program in Mexico that was like, they had like a kiosk in a
Hand
school.
washing in schools.
And it was like a very interactive thing. It was a rainwater harvesting system, but the kids could see like all the process of like the cleaning of the water and then the hand washing facilities. So you would like go in, the kids would go inside and see the whole process. and it was like a fun way to wash your hands. You know, like games in the process, and they were like learning about rainwater harvesting, the treatment of the water, and then they wash their hands. So something, I mean, that's related to gamifying it. And also related to the paths.
Yeah.
Like I'm gonna put just like smart kids, no?
So like if a parent is like,
Or what if like, because these are bathrooms for children, right? Is that the idea?
you know, do some.
Yeah, so what if like,
For children and schools.
yeah, what if like the dispensers had like,
Parents school day.
Like a Pixar character head or something that was like soaping out of, so it made the experience entertaining.
Hand washing and
It
just
was,
water quality.
Shrek juice and not just soap.
And the soup could be like rainwater color.
Yeah, totally. Like a dragon, like foam coming out was like orange or something.
Yeah, I'm thinking like trying to think like have it part of their homework as well. Go home and like teach your friends or teach your family or make sure you do it before you eat dinner or something. And it's not just in school, but it's throughout their daily life.
Building off of that, what about like, also, I'm thinking like about like in low income situations, like just like kids design or like have like a competition to like design what you would paint the soap dispensers. And then like forget building the system
That's kind of neat, like, if they, you know how you can go to like a Build-A-Bear, like a pottery bar, or like a pottery, like you buy a pottery, but then you get to paint it.
Yeah.
You know, like you can have like different figurines that would fit over the soap dispensers or whatever, and then they get to.
Personally, I don't work on it, so I'm not sure. I was thinking about that last night though, because
Maybe some like ownership over that.
Yeah, I love that. That's
Game or
human-centered
something
design,
like a
right?
phone or some technological.
That's great.
But that might not.
Maybe adding 2 poems and letters, it could be some other forms of art, no? Like painting and that could be related also to the functional. No? So,
Yeah. I think that like is just a cool question to like what years or older like that. Like, are there board games?
Yeah, exactly.
Like what could we
Yeah.
that? Now I vote for board game.
I don't know if this will work for children, but I've heard, y'all have been in, that has like a survey, as you're leaving it, it's like, you know, cleanliness, and it's like literally just a thumbs up or a thumbs down. And like, for like,
I mean, I'm always pro.
for the adult experience, I don't know, I've always enjoyed that simple.
All of these are important.
I've always thought it was brilliant, feeling it's contributing to, the future cleanliness of this bathroom, by way of just saying, I don't know what it would be, but some way to engage a kid, you can almost ask them, you can almost ask, and I guess this is assuming that they can read.
I wonder what other subjects they could be
But even like the smiley face,
I
frowny
think science
face.
is the obvious.
Yeah.
Yeah, or there's other ways, I mean, like, babies have agency, right? So, yeah, I think there's like other ways to bring them in and have like kids of all ages involved.
Yeah.
and that could be like told in a classroom, no? And just like a smiley face, you know? Like you put a pebble showing the smiley or the not, and then
Or is there a way to do
them assessing the toilet and giving feedback to the.
it would be interesting to understand, like, behavior changes.
Yeah, through imagery.
Just because we know hand washing is
Because the
good,
question is like,
doesn't mean
did
we're
you wash
actually
your
going to do it,
hands?
which I
Or
think
like,
is going to be one of the.
or something around hand washing, right?
Right, like how
Not so
we
much
wash
for fun as the bathroom, that would be.
a wash conference
Or like,
professional.
you have like, someone washing their hands and then a smiley face or a.
Well, I was thinking about it.
But then all the ones that hit the frowny face didn't wash their hands.
But so like ways of achieving these success, no?
Yes.
And I can imagine a kid just occurring there,
Yeah.
smiling to get a prize.
Yeah.
I think is like,
I mean, the dispensers and entertainment's great. I think like the same type of thing with
Do 5 minutes.
having your hand washing solution actually be innovative and exciting. I work for Kohler, so we make products. And I work for Kohler Company. We haven't met yet. I know who you are. You work for Business Connect, right? Yeah.
Say Kohler.
Yeah. But like working throughout Asia and Africa, it's exciting to see kids like
That's right.
it's kind of clear that most students just interact with like a valve tap. So having an actual solution that excites, that is not what they have at home, has been a driver for us.
You know, think of your own, not just your hand washing.
And that doesn't extend just to Kohler, it's to many different
see which
solutions.
ones work more.
Just something that isn't their everyday interaction. I think good examples like Splash.
Yeah.
Splash also has a solution where it's exciting for children. They will never have one at home because it's just for hand washing. And it's the same with our solution in that sense. It's thinking about the product level. Because a lot of these are like dependent on an adult coming in and like continually doing it. The footsteps are great, so they're all over, it's super easy, but everything else requires like a lot of inertia to continue going. Whereas when you talk about infrastructure, it's just purchase that shouldn't have been for a long time.
Sometimes they're a little bit, this isn't cooling, or like.
Well, first taps and any other idea. I mean, you already listened about the discussion, but any other ideas or what you've seen?
The valves and taps are like just what we focus on, so like it's like a little more apparent. The soap stuff's super interesting though, because like it's such a big challenge. I feel like, yeah. Soap tends to walk away. That's everyone's universal experience, I think, right? Soap disappears, like bar of soap is gone the next day. Or like, I know some groups, they use like water bottles, they're like kind of like dirty, they're not dirty, but like crushed up water bottle because they don't walk away as quickly. There's this like social engineering window, like it's, I wouldn't want to steal that. I don't know why, but.
I guess I'm thinking too what you said about like adults having to be involved in like a majority of these, like then I really don't think these are working without that. Like these two groups are like obviously like very like enmeshed. It'd be interesting to know what they're coming up with too.
Okay, you guys want to think about who you want to present?
How, like, the effects of,
Just a minute.
like, how to make sure that they're not wasting water either. So, like, we can integrate it into the curriculum in that way.
I want like Bart
Talking about the effects of.
Politely.
Yeah. I can do it. No one else
We're gonna
wants?
wrap up session about who you want to represent, and we'll come back.
We wrote a lot, so I hope I can. I mean, they're interactive in a way, no? It's mostly like interactivity, fine, I think maybe scientific part.
And all of this could culminate in like a multi-school competition.
All right, you guys, we're gonna, and we'll use the microphone so that the folks online here. We also have some good suggestions from people online, so I may read those first. Who wants to be the spokesperson for group one? And the writer, you the spokesperson.
Yeah, I know. Oh, should we bring it up or?
Yeah.
Okay, before we have the teams present, I also want to nod out to the folks online because they had some great ideas as well and points. So let's make sure I capture those. So Alex points out that capitation funds for schools, to schools, especially for wash in schools, should be referenced and not diverted to other vote heads. I think to other funds. I'm actually having a hard time scrolling this. 1 second. Mava pointed out, Alex, when you talk about Vibrant Health Club, what kind of initiative they can undertake or how they can translate into action. And Alex said, on the second group, yes, hand hygiene should be integrated during curriculum reforms In Kenya, the new competency-based curriculum has integrated hand hygiene. Engaging Kenya Institution of Curriculum Development, which has authority to recommend what materials should be incorporated into the curriculum, is key. Cameroon, Fanyui. Greetings, looking at the two options. It's possible to implement hand wash in schools. Sensitization, construction of infrastructure, creation of committee and monitoring. And Alex pointed out initiative to undertake for vibrant schools. Health club includes capacity building, inter-school health club competitions and rewards. And I think that's that. So with that, let's, and thank you for the folks online for contributing. And we will turn it over to team numero uno. So you guys want to?
Thank you. Can you hear me all right? So we, as you can see, we went through a lot of options, which kind of can be summarized in gamifying. So when we're talking about kids, we think that a way to nudge them is through making it fun. So we thought about painting the way to the hand washing facilities through footsteps or maybe interactive kiosks where you can see the process and learn a little bit about it. We thought about innovation in the infrastructure design as a kind of an easy win that doesn't involve too much of the adults. No, if you have the infrastructure, then it's up to the kids to just have fun with it. And some ideas were bulbs versus taps, so that they can have like a different technology in school than they have at home, and it's a bit fun. There was an idea about making the soap dispenser fun, like a dragon or a Shrek or a monster that dispenses the soap that is like boogers or whatever. And then we also thought about having like an engagement and ownership of the infrastructure through artistic expressions. We were thinking about poems, letters, or painting in the facilities, and kind of helping the kids engage with the stations and feel like they own them a bit more. We also thought about competition, like a friendly competition to make to help kids engage. That could have both elements. One on the winning side, that like tracking it with stickers and giving prizes and nudging in that way. And the other element that was maybe it's a bit more controversial, but the shaming and public embarrassment element, to make it kind of fun, not too fun that they want to be shamed, but maybe like a glitter explosion if someone doesn't wash their hands or something like that. And I think that's it. We were talking a bit about education and how this can be linked with gamifying, but it's part of what you will cover. So all of this makes sense with what Group 2 has to say, so I guess I'll stop there. And I don't know if I missed anything or anyone else.
Yeah, does anyone have any questions or comments from either group? Or on one? Great, thanks so much, that was excellent.
All right, Kyle. Woohoo! We represent our group.
So our group, we wanted to, sure, thank you. We wanted to try to make it a routine in the curriculum, not just a special day like the World Handwashing Day, though that would be a great way to highlight the different routines and kind of like make it like more of a celebration. Some of the other ideas we had is to have a song, like maybe before they have lunch, to kind of have a reminder and like they can look forward to that throughout the day. Different fun shapes for soap, such as like a lemur, especially if they're in Madagascar. Embedding it in other classes, such as like science, talking about like bacteria and like why the soap kills the bacteria, or like in history class, talking about like Louis Pasteur and like the effects of sanitation and hand washing and discovery of bacteria and diseases. Different fairs for hand washing, where students can act out what they've been learning, similar to what you all were saying in Group 1, like an art contest to try to make it more their creativity and more design, as well as maybe like a play that they can act out. if different business owners or parents in the community want to stop by, they can talk about their different activities or what they do and how they can implement that in the school and kind of show that this is a whole community-wide effort and not just in the school. Having like lower tech, more accessible ways to teach about hand washing, such as like a board game or a poster that they can do, or like coloring books or word searches. And then think of like how kids compare and contrast what their own nudges are and see maybe they could share with others. And then we have one more page that even, because we're thinking that these are mostly about the younger children and grade levels, but even for the older grade levels, we wanted to still get them involved and make sure they're continuing to do it. So we're thinking, oh, maybe they could start teaching the younger kids or showing them how to properly do it so that everyone can be involved. And then also maybe teaching them how not to waste water and kind of save water and the routine of that. And then also just competitions as well. I'm sure you all were saying in group 1. So any questions or comments? Yes.
Yeah, I just wanted to hear more of the technology into how it will be used to improve handling across those groups. Like we have seen the virtual reality kind of platforms being used in different kind of simulation exercises. Is this something that could be leveraged in schools? And how feasible would it be, especially for the low-income countries?
Mm-hmm.
Try to repeat that for the people.
Sure.
No, go ahead. You just repeat his
Oh,
question.
about the different technologies that can be incorporated in the school. Is that the question? I would say there's definitely ways to do it depending on the resources that are available or the funding, but I think that would be a good option to include as well in the schools.
Excellent. Yeah, thanks you guys. You know, it strikes me that when I first got into this field, I'm a civil engineer, and we called it Watsan, and it was very technical. It was about infrastructure. It was about how many boreholes you drilled, how many hand washing stations you provided, never mind that they never had water or soap. But it's, the field has really matured to where we can have sessions like this that are entirely creative. This is all right side of the brain stuff, right? Not left side. So it's pretty cool to see that progression in the field. So next we'll get to the meat of the presentation, or the heart of it. And hopefully the recording works from Mava. Mava is also online, yeah, it's the, so again, these are, I've introduced these folks already. These are our folks that put together the presentation and worked on the program. And Mava Rakatosan is going to present the results of the study around primary school hand washing in Madagascar.
Morning, good
Yeah.
afternoon, good evening for everyone from all around the world. I'm Meva, the regional manager at HappyTap. I'm happy to join you today with my other colleagues from CARE and Fondation Mérieux to talk about what we have done in Madagascar. So what is it about? It's about an experimentation where we investigated the impact of hand washing interventions in primary schools in Madagascar. So we, as a free organization, we both already work in that space and have different approaches on how we sensitize and promote hand washing within schools. But we have that idea of bringing together how we can join our hands and collaboratively do some intervention that help to sustain the behavior, because that's another area that we have noticed separately in our work. Like getting them to change the behavior is one thing, but helping schools to maintain that habits is really challenging. Let me go through one by one of each approach. The first one was implemented by CARE through the Handwash project, which was funded by USAID from 2017 to 2023. Handwash worked with several entities as a big consortium to work on different areas from water, sanitation, and hygiene. So today we will just focus on the hygiene part of it, where the Handwash project bring the nudges to trigger hand washing behavior. What is it about is improving the environment to influence individual decision. For example, for bringing kids to wash their hands from the toilet to hand washing stations, they have a colorful signals like arrays to guide the kids where to wash their hands, and with hands sign like drawing on the hole or whatever it may be possible within the area. But the idea is really to get this improved hygiene where the kids can easily find their path to do the behavior. The second approach is the new normal in hygiene, led by HappyTap, where the idea is to bring hand washing within reach. HappyTap is a social enterprise who promote the hand hygiene through innovative product, which is the hand washing facilities. A station, a portable station, and convenient to make these hand washing practices easy. The idea of the new normal is to ease that access to the stations in terms of increasing the location. For this experimentation, we adopted the minimum of one hand washing per classroom, but also through the attractive hand washing stations, the practice in itself will be made easy and possible wherever needed, as often as they need it. The third approach that I would like to talk more with you is the one designed and led by Fondation Mérieux. Fondation Mérieux is an organization, an NGO, who supports the government in terms of fight against infectious diseases through support to laboratory and also some scientific research to feed policy and national guide. So with the wash kit, it was designed with innovation and also interactive playful tools to easy the promotion of hand washing behavior at schools by teachers. So through that kit, the key messages was integrated, and it was dedicated for kids who have capabilities to read and write, and also for the teacher to have tools to integrate with their national guidance in terms of having the hand washing as part of curricula. What are the objectives of the experimentation? There was two objectives: feasibility and also the impact. So in terms of feasibility is to describe the implementation processes and assess their feasibility. Mostly if we talk about bringing free organization to do the intervention. And the impact was not only the individual impact of each intervention, but also the added value of common or simultaneous work by the free organizations within one. The methodology adopted for this experimentation was a quasi-experimental one within 5 primary schools in the Vakna-Karacha region, which is slightly in the south of the capital of Madagascar. And as As I mentioned, within these 5 schools, we have chosen to have one separate intervention within 3 schools, and within 1 school, we would have combined the intervention from the 3 different approaches, and we took 1 school as a control school where we didn't do any intervention during the study period. The environmental conditions for this study was a minimum access to water for all schools, and also hand washing facilities, and the provision of soap. So we had to ensure that each school have access to soap. The variable that we took into account was the number of hand wash with soap reported to the number of students. The conditions are: the observation has to be made during the recesses, or during half day of school, with 2 recesses. So even there was hand washing between recess, we counted them. And we had to ensure that each observation would have done impromptu. And observers are different from the organization who is the implementer, which was the implementer. We had free observation time as a baseline, the T0 before any intervention, and T1 6 weeks after implementation of intervention, and 18 weeks after the implementation. What we out of that experimentation, we compared the number of hand washes per school during those 3 periods. Unfortunately, we were not able to get data from 41 for one of the school due to the context, and also due to the implementation of the interventions, because this is where we combined the 3-1. So we had to deal with the different situation and barrier within each organizations, also in terms of timing. The reason why we don't have T1 for the school E5. However, we had to respect the observation time, so we have the number of hand washes over the period. It is important to notice that the number of hand washes can be, if you take into account the number of students and the number of hand washes, even though they are quite similar, like the example of E1, 113 and 118, it doesn't mean that each student wash their hands during that period. So it may be like one student have washed their hands 2 times or 3 times, wherever it is during that period. The main result through that experimentation was a big change in terms of number of hand washes, which is the change is really significant for E1 and E3. Those are schools who received nudges or wash kit intervention. Within those schools, the change over the T1, T0, T1, T2 was really significant, even though it is increase or decrease. However, for the school, otherwise for the school E2 and E4, where they received the new normal and also the combined approach, the change was really steady, like steady increase or steady decrease, but there was no like really big change within those schools. The interpretation of that could be double-sided. One is the school maybe already received, even before our intervention, already used to apply the key messages through previous intervention. by the Ministry of Education, by the government, or by other institutions. But that also may interpret or translate the fact that those schools knew that we are from the external and we are there to evaluate them, so they had to behave appropriately. That was part of bias that we took into account. However, the result is there, and we use that result to feed our own reflection. We were able to get from that the approaches in itself were complementary, because where we combined, we saw that complementarity both from internally within each organizations, because we noticed that the others are working more in physical environment and the others are more for the behavior and education. So those are kind of different elements that we saw. It is definitely complementary. But also in terms of feasibility and acceptability of the combination of the approach, we have noticed that along the period of the implementation period. And we've noticed the importance of involvement of schools and institutional staff, of course, because each school have their different context and also face different challenges. So we better benefit from their involvement and their ownership. One thing that we have to agree from that experimentation is the positive impact on hand washing. Even though we felt that as a bias, but we saw that it was positively impacting the behavior of students or the teacher. The limits of the experimentation is the absence of randomization, as well as the difference in terms of denominators over the free observation period. In some of the schools, for example, in the control school, we had to have 2 half days because the grade 5 and the target classes, they were separate, so we had to allocate more time within those schools. Or in some schools, the number of recess was just once, which impacted in the number of hand washes. And we had to recognize that some other bias was also applied along the experiment. We can conclude that the feasibility of intervention in the school context was due to the synergy between the three organizations, so we were able to conduct the experimentation. And as I mentioned earlier, the positive change on children or students' hand washing behavior out of individual action. Otherwise, we cannot confirm based on the figures that there is an added value of combined action. We have noticed that we need to improve certain aspects of the methodology and also increase the number of samples to be able to have significant results to influence any change in the future. Based on that, our perspective is to roll out at larger scale to generate results that would be useful for the ministry to influence the policy or to come and complement with the existing national wash-friendly schools initiative, which is an initiative to promote wider implementation of wash approaches within more schools in Madagascar. So that concludes this presentation for today. I use that opportunity to wish you happy Global Handwashing Day we still work and collaborate to make to remind everyone why it is important to have clean hands. And special thanks to schools, principals, students, and teachers who helped us and who is the reason why we were able to do this experimentation, but mostly our colleagues within Fondation Mérieux and also Care International. So, Misocha, as we used to say in Malagasy. Over to you, Rod and Glove. Such.
Great. We have several of the folks that were part of the presentation and putting it together online. Hopefully you guys can unmute and talk. I'll also open up the chat here just in case. But we have about 10 minutes for questions, and we have Hadasoa from CARE, Miva from HappyTap, and Nevo from Mérieux online. And Miva is the one who gave the presentation. So any questions? Yes. Oh, yeah, actually, let's use that so they can hear.
This is a little bit of a niche question, but for E3, which I don't remember which specific intervention it was, it looked like there's a fairly, not statistically, but visually significant drop in the percentage of hand washing between the baseline and time 1, and I'm curious if you have any thoughts as to why that might have occurred and then picked back up significantly at the 3rd time point.
Great question. Yeah. So can you guys unmute and did you hear the question and can you answer it? Please tell me that works. Yeah, you guys can hear us, right? Because I'm not able to answer any of the questions. All right, let's just check that real quick. Okay, so do you, oh, it's allowed to talk?
Let's go to Nevo, you can speak.
Yeah, Nevo, you're unmuted. Man, I think everyone else is with Ava.
Yeah, and maybe you should be able to.
Can you hear us?
Okay, so, oh, that's because we're standing here with that.
Yeah.
Okay. Yes, we can hear you now. Did you hear the question? Oh, darn it. I thought we had everything, so we're all set too.
Can you repeat the question, please?
Yeah, the mic's off.
And I've got this one covered up.
Can you hear us? Sorry for this.
Yes, we can hear you. Can you hear us okay?
Yes, we can hear you, but we have not really hear well the question.
Yeah, I'm not sure why that's happening.
Yeah.
The question, please.
I don't hear them when I cover this up. That's weird.
Yeah. There's a big echo on your side.
Do you guys have your speakers? Maybe you need to turn off your speakers?
Maybe try speaking again, Avo.
Gosh, it's an hour.
I hear you well, but
Maybe we can.
we want to hear again the question.
Yeah, mute Nevo. Oh, she is muted.
Yeah, it's all coming from Avo. Maybe if there's a way we can mute our microphone.
It's usually here. That's our sound we would mute. There's mute mic.
Avo, could you try speaking one more time for us?
We can hear you well. But we didn't hear the question. Can you repeat the question?
How about you answer, if you can hear the question, can you answer it in the chat, and then we'll just read your answer.
I think they might need the question based on
The question is why the E3 dropped at T1, right?
Yes.
Yes. Yeah, that is the question.
You may not know, and that's okay. It was interesting to me.
Oh, I muted us, didn't I?
No, we can still hear us.
Okay. You don't want that, okay.
Yeah, so Avo, Neva, or Meva, if you could type your answer in the chat, that would be great.
No, we can't show the chat.
We can just read it off.
Switch one? No, read it off.
Yeah.
I was really impressed by how Meva got her pre-recorded and her face in there, and it went from
yeah.
It's like, I'm like, how did I got to talk to her about how she did that. So.
Is that Loom? That's got to be a Loom recording, right?
No, PowerPoint itself will do that.
Oh, wow.
Yeah, I didn't know to help. Learn so that I can tell someone how to do it.
Go ahead.
Okay, so we have an answer from Meva. So Meva said that the observers changed at T1 for the E3 school, so they misunderstood the counting process, so missed to count the repeated action.
No.
Okay, yeah, that makes sense.
Yeah.
Cool. Does anyone else have any questions?
Yeah.
No?
So my other question was related to how you chose how you were going to do observations for hand hygiene and like the method of recording. So using the number of students divided, the number of hand washing actions that took place. Curious what the impetus for that approach to your outcome variables was.
Great.
You can rephrase that in a better way if you want. The coffee is wearing off.
Does that make sense, Meva and everyone? Go ahead.
So Mavis said that the students were provided with different bracelets that had different colors for each grade, even the grade not targeted for the counting.
Does that answer your question?
Not really, but that is interesting to know. that could be a different way to like disaggregate and see if the impacts were different at different grade levels. Again, I am a little bit removed from the school space, so I'm just curious, like at doing observations in healthcare facilities, we often sort of like will observe an individual and like mark if they specifically have or have not practiced hand washing, but that seems like it could be a time and resource intensive approach. So I was just curious how you landed on this way to do hand hygiene observations.
Yeah.
No, good idea.
And she also just said that the observation was made at each hand washing point and that they only counted students for, oh gosh, this is coming in so fast. Yeah. But yeah, no, thank you. That is a great point.
Oh, yeah, and I'm just curious. I'm less well versed in the space, so I don't know if this is something folks normally do for hand hygiene observations in schools. So
Yeah.
I'm just curious. Thank you.
Any other questions? Yeah, please.
I've just been so excited to be learning about schools today, and I have a lot of coffee. I'm curious, you mentioned on sort of your last slide, thanking your partners. And so I saw that you mentioned sort of the Ministry of Education, principals, teachers, and sort of community members. And so I'm curious what sort of stakeholder engagement you did as part of this work to engage sort of these different people that have an interest in hand washing in schools.
Thank you. And if you weren't able to hear that, everyone, the question was, how did you approach your stakeholder engagement for all of the different partners and actors involved in this study?
Doesn't tell us if they're typing.
Not on Zoom. Doesn't please. Okay, so Meva said that stakeholder engagement was focused locally. The observation was done with local representatives of the Ministry of Education, and at the national level, the methodology was, I guess, conducted with the Ministry of Education and was okayed by the Ministry of Education. And Hariso echoes that, saying that they worked with the Ministry of Education and all of the school's staff. So it seems like there was a very integrated response from the kind of local level with the schools up into the Ministry of Education. And Meva also says that the report was shared during the review of the National Guide for Wash-Friendly Schools and gathered all the actors to share the main insights from the experimentation. So not just kind of informing them of the process, but then the results were also shared out with all the partners. And I think we have time for one more.
Yeah.
Okay. And any more questions? One more, perhaps?
We should have a prize for the most questions. Okay. So, debriefing and insights.
Yeah.
We're good.
Yeah,
Thanks.
thank you, though. So yeah, just going to ask about some debriefing and key insights. So this is open to anyone. What key takeaways on hand washing with soaps at schools do you have after this session? I mean, for me personally, it seems like it's really beneficial to do this comparative analysis approach to where we have different kinds of hand washing behaviors and nudges and trying to compare them to see how they work over periods of time. I think that's really key, and not just focusing on one, but really trying to understand the different ways we can do this. Does anyone else have any other key takeaways?
Yeah, I think I am just really interested in thinking about how to build on nudges, right? Or like how to have nudges added together. That's not the right word, but like to have them complement each other and understand the ways in which they do or don't complement, which is a helpful thing to see over time. So
Yeah.
kind of similar to your takeaway, but
Yeah, absolutely. Like not only just comparing them, but like understanding how they work when they're integrated with each other. Yeah, there's lots of different possibilities there. Another takeaway that I have, that I got especially from the interactive session, is again making this fun and approachable and exciting from the perspective of the students, and understanding what that looks like in different contexts. Because what might be interesting for an American student might not be interesting for a Malagasy one.
Good point.
Another key question at the end: do you think you could apply these concepts in your community, school, or different intervention areas? Are these relevant to any of your own contexts?
Yeah, I would say generally, I think I'm looking at Fred as well, because we were working on a project together on trying to improve hand hygiene in healthcare facilities, and so I think we use a lot less fun nudges, I think, in healthcare facilities. So we've used a lot of like the My 5 Moments for hand hygiene posters from WHO, I think. Sorry. And so I'm curious if, I know we have some limitations on what we're allowed to post on walls, so that's been an issue we have, but I'm curious if there's a way to bring more fun and joy back into nudges in a healthcare setting is something I'm kind of noodling on, and I don't know if that's feasible, but yeah, it seemed like that was a key theme in what we were working on. So, what do you think, Fred?
Yeah,
Can we bring joy into nudges? No pressure.
I think that we, especially if we can think about pediatric hospitals, or maybe during immunization days, where we have lots of kids coming to the facility and, you know, have them learn the issue of hand washing. We're already seeing adults trying to perform hand hygiene compared to young people. So maybe for schools, we'd like to think about how we can empower health clubs, and these clubs provide that all sustain such kind of interventions.
Thank you. Any others?
I mean, so I work with IDE, and so we don't do much in schools or health facilities, but I'm thinking about like the cross points and some of these nudges with the entrepreneurs and the businesses that we work with, and ways in which there's some crossover there, and if there are ways we can do it more intentionally to, like, you know, the nudges we think about might be different, and I'm just questioning some of if that always should be the case.
Yeah, no, I love that point. Yeah, because it's a program to where you're trying to encourage, you know, parents to be involved within the markets of field latrines, or trying to sell different types of toilets and things like that. How can that be like a whole household affair?
Totally.
And then kind of the last key insight here, what are some of the challenges faced when implementing these actions, whether it's the nudges or trying to work with the different actors and trying to make sure this isn't just a local experience, but can be cascaded up, you know, beyond just one school. What could be some of the challenges in making all this happen?
Behavior change is hard.
Yeah.
Yeah, that's a good point, and building off of that, beyond individual behavior change, I think a challenge that we've seen a lot is around this idea of sustainability. So you have shown some of this work that there are promising results, and so how do we get these promising results, share them with the Ministry of Education like you've already started doing, and then find ways to, I don't know if institutionalize or professionalize is the right word, but people seem to like to use those words here. So building those in to be a little bit more self-sustaining and something that's taken up at that national level and then continued to be maintained by the Ministry of Education and adapted and then rolled out. So taking it from what you've learned here and then bringing it to scale and promoting ownership by in-country partners seems like that could be challenging. So if you have that solved, would love to hear that because we could learn from you.
Yeah, that's a really good point of just like how to get the ministry excited about not even necessarily doing this exact intervention all over the country, but having this approach to experimentation and piloting different models in different areas of the country to where different nudges might not work as well in some places than others. How to get the ministry excited about that, I think, is a good challenge.
Yeah, I think this also applies when we construct latrines at schools. That a hard lesson we've learned is that ownership matters, right? So if the school administration is sensitized, triggered, and motivated to use those facilities correctly and to maintain them and sustain them going forward, if the teachers especially who are overworked and underpaid and have lots and lots of priorities put on them all the time, and they can often see, especially hand washing and hygiene curriculum as just another thing they're supposed to add to their lesson plan. Where am I supposed to put that in? The devil's in the details of these things, and so. But I do think that ownership element is it's key to see that the administration and the teachers feel that they're part of and designing the approach versus just being thrust upon them. So, and getting up to scale, then that ownership needs to become part of the Ministry of Education and such. But the top-down approach doesn't work for me, as with 99%.
And just to add, Mavis said in the chat that behavior change is hard, but once it works, the result is genuinely amazing, and that we need to be in the shoes of our targeted people and students we're working with.
Awesome.
Yeah.
Sure.
Well, does anyone else have any other key insights or anything we haven't touched on that you would like to share? Any burning comments? Okay, great. I think that's everything then.
Yeah, we just thank you guys. Hopefully you've enjoyed the interaction of the session. I learned a lot just from our Madagascar colleagues and yeah, so I appreciate you coming today.
Yeah, thank you so much. And Maeve also says thank you.
Yes. Not only did I get to keep one of the filter bottles, but I didn't keep any of the UV either.
I know. I was one that gave one of those time too. Let's see.